Yes. Yeah. So it could be the magnitude is different in different countries, but overall, if you are born in a poor family, infant mortality is almost double everywhere. So the magnitude or the volumes might change, but so again, is it the child's fault that he or she or they are born in a poor family?
No.
Anybody? So whose fault?
No.
Nobody's. Whose fault? I'll come to the health system, Roshni. We're talking about health, by the way. So the way the society is organized, arranged, the inequalities in the society decides the health status of the population. Anyway, let's get some more messages. Yes, this should be easy. Anybody quickly? People are still slow. Okay. Education and race intersection is one. But vis-a-vis what? With respect to what? Yes. How, Gayatri? You can unmute and then talk. You are unmuted anyway.
That the race determines how whether the infant survives or not.
Yeah. And what else? Whose race?
Of the mother.
Correct. And what else is a determining factor?
Education.
Yes.
How much the mother is educated.
Yeah, people are more trigger happy to use the chat with my what you call presentation. I'll have to. It is tough to follow the chat. It's okay, fine. I'll have to manage. That's my problem. Okay. Thanks, Vineet. Yeah. So with increase in mother's education, what is happening, Vineet?
Infant mortality is going down.
So what do we? So infant mortality, life expectancy at birth. These are all population level indicators to show the health of the society. So how do you achieve better health of the populations?
By educating mothers.
Or the previous one?
Reducing inequality.
Reducing inequalities or increasing the incomes of people. All of us are clear? Yes? Shall I move forward? So the higher the education of the mother, better are the life chances for the child. The race one we will come to. What happens for race? We can in India talk about caste and other things, even though it's not the same. Caste is a much more what you call deeper intersectional. But yeah, so yeah, it is true. So what we are talking about is different types of races.
Yeah.
Okay, so now tell me this. This is what is called as the famous Whitehall study by Michael Marmot. How many of you understand Whitehall? Yes, Calvin, you should.
Mike.
Oh, sorry, Mike, is it? Okay, I
Mike.
saw your, yeah, good. Anybody else can understand Whitehall?
The mortality rate among uh, among different staff in the, I think, the Queen's office or something like that in Whitehall. That is in the government service. Their mortality rate increases. The age of mortality reduces as you go down the hierarchy of the staff.
Yes. So these are all, I don't know whether it's white collar, blue collar, I've forgotten. These are all civil servants working in Whitehall. It is not anymore about poor and rich, by the way. We saw here, no? Poverty and all those things. It is not about poor and rich anymore. These are civil servants. They are public servants who are working in a government, having reasonable, stable job. Even there is a differential in health. So it is not just about poor and rich. It is about where you find yourself in the society. And that is what is called a social gradient in health. So Michael Marmot clearly brings out this fact that the social gradient, where you find yourselves in the society, is what gives you your health status. So this is having other connections like power, decision making, all those sorts of things come into play, and that is how you have even mortality rates between reasonably affluent sections of the society. All of you with me? Clear?
Yes.
Yes, this is nearer India. This is India rather. Take any column and let me know what you see. Sorry, what does it, Anand, you are having a question?
Yeah, so
Do you want to unmute?
what is the implication of that? I didn't understand.
Yes. So the inequalities in the society, the power inequalities result in health inequalities. Okay, so it doesn't matter. I mean, one way of analysis is rich and poor, but even where you find yourselves in society also determines your health status. So that's what is called a social gradient in health. So it doesn't have to be only rich and poor. It can be also between middle class and rich, and that sort of a social gradient exists. Am I
Thanks.
making sense?
Yeah. Go ahead.
So the initial slides were about rich, poor, uneducated, and all those things. And final one was about, it doesn't matter where you find yourself in the society, what your social status is determines what your health is. Yeah, sorry. Yeah, this one, anybody wants to take any column and then let me know. Any column.
I'm interested in the religion thing, the neonatal mortality in Christian 6.7 versus in the. I don't know what the significance of that might be.
Yes.
That religion also determines or is also related to health,
Also
equality or
because,
inequality.
yeah, also because the Hindus have, the classification in this database, National Family Health Survey, I'll put the source also. Yeah, the classification of Hindus is also with including scheduled caste and scheduled tribe. And that is why it shows a little skewed one. But yeah, overall, what Gayatri talked about is what it is. Yeah. Anybody else, please, quickly?
It looks like there's a gradient in all the categories. There's
Yes.
too much data to make out, but between schooling and all these indices, religion, caste, and wealth index.
Correct. Who's schooling? There is written a background characteristic. Background characteristic of whom?
It's not stated here.
Yeah. No, I'm asking.
Must be the mother.
Yes, it's the mother's background characteristic. So what is the deduction, so to say? What are we talking about?
All is social determinants.
I agree. No.
Yes.
Shall we do a ratio bit? Shall we do the ratios?
Schooling, if you just take neonatal, somebody else can go ahead. Yeah.
Yeah, Sharath. Go ahead. Okay.
May I?
Yeah, go ahead.
Just call me.
Okay, in this, if you look at the years of schooling, right, anyone less than 10 years, the mortality rate is almost more or less the same. And one kind of finding is that those who had less than 5 years complete has more neonatal mortality rate compared to those who had no schooling at all. But otherwise, if you look at it, it's a constant gradient down. Like as the number of years of schooling increases, the neonatal mortality rate in that group decreases. But even within that group, you can say that among those less than 10 years and more than 10 years, it's kind of like doubles or it halves when it comes the years of schooling of mother is more than 10 years.
Yes, if you look at the last column, that gives a clear indication. If you provide schooling to mother, you're reducing infant mortality rate by 2.5 times. Do we understand this? As to what it means to provide health for the population. Just providing schooling reduces infant mortality rate by 2.5 times. Or under 5 mortality, as you can see. Of course, then the usual ones, the caste ones, as we saw the race in Brazil, there is a caste gradient as well, and then there is the wealth index. So, what do you want to do given these inequalities? As a health professional, what should we be doing?
Can I ask a doubt from this slide? I'm so
Yes.
sorry to interrupt.
Yeah, no issues.
Okay. Yeah, my doubt was that when you're looking at the number of years of schooling, we do not differentiate between the different communities, right? That is schooling of scheduled caste, scheduled tribes, other backward castes, like that. So when we look at that, what if those who have less than 10 years of education is more from these backward communities?
So what you can
How
do
do you
is
attribute it to schooling alone?
Correct. Okay, so there are multiple, what is, the most abused word these days is intersectionality. The ones who are scheduled caste or scheduled tribe will be also the poorest, will also do not have education. So there are multiple intersections, as they say. So what NFHS does is, National Family Health Survey, it does categorize this in these 4, indices, so to say. And then, of course, if you go inside, it will show whose schooling it is talking about, where did they calculate, get this and all. I'm not going into those details, but just wanted to give you an idea of what happens in a society which is unequal. That's the message that I wanted to give. Am I okay with this? Sorry, you are P.
Prasanna,
Chan.
there is some correlation, but does that also imply causation?
Yes. If you, for example, let us say you are a scheduled caste person. Okay. So, I think somebody has asked that question, no? Am I seeing that question? Somebody has asked, I think. Anyway. So, there is a correlation actually between your economic status, between your caste status and your schooling status. There is a clear correlation, and it is, so whether it is causation, yes, it is a causation, because again, if you look at health inequalities, it is also having power inequalities, power as in economic power, knowledge power, all of those. So if you are less skilled, you are bound to take up menial jobs. And if you're bound to take up menial jobs, then you will invariably have lesser schooling, which will invariably result in higher infant mortality of your children. Yeah, there is a causation web there, not merely correlation. Yeah, Sayantan. Sorry, I can't see the raised hand because of my projection, so somebody has to do that. Yes, luckily I saw Sayantan. Huh.
Yeah, this
Yes,
is more
Sayantan.
like comment. I think you'll cover this anyway, but I
Hmm.
think the dangers are sort of framing it like this, that okay, more years of education reduces infant mortality. So then suddenly all the NGOs and philanthropists in the world will start giving education without checking the fact that access to education, access to quality education is in fact a structural issue, which is dependent on race, on country, on economic status and all of that. So my simple question is, if someone sees data like this, how can the framing be such that people don't, again, people who are not necessarily as politicized as suppose this group, how do they not basically take the dog by the tail and say that the tail is wagging the dog basically?
No. We are not even talking about quality of education, Sayantan. We are just telling about literacy. That's
Right.
the level here. Of course, we know who gets educated, who for whom education works. We'll come to that hopefully today during one of the sessions. I mean, during one of the discussions. So we are not even talking about the quality of access, quality of education, who gets what. This is plain literacy.
No, I'm
Just
saying
you
even
provide, yeah.
I think my sort of blinkers when goes up, because then instantly someone might say, okay, give them more literacy, that will improve their IMR, MMR, without going into structural issues which in fact determine the access to literacy in the first place. I think that's all.
Fair
Yeah.
enough. Fair enough. What I'm trying to tell you is just give them literacy as a starting point, for example. I mean, I'm not telling that's the be all end all, but even that goes a long way. Looking at the literacy rates in this country today, we are still at 65%, if I'm not wrong. So even just raising the level of literacy might help us in some ways. Yeah, of course, it is not the ideal. We would look at quality of education and all, but at least that's a starting point. Shall we move forward?
Prasanna, somebody has asked in the chat if
Mhm.
lowest wealth group tops three out of five parameters in this table, and 2 out of 5 is education related. Are we seeing that better livelihood or income skills or schooling for women would be the best option?
That's exactly what Kerala did in India. Just 20 years, they focused on just literacy. And where we are today in Kerala vis-a-vis IMR with respect to MMR, we all know it's a what you call fable story, or how do you say that? It's a romantic story there. Yeah. So that's the message here. Yeah, Sabin.
Yeah, sorry, I had to drop out for a while to go to hospital. But
Sure.
since you're talking about education, I just thought that I'll mention a story from Odisha also, because Kerala gets quoted very often. And I thought it's fair enough to quote Odisha. So there is a tribal school in a place, the district Rayagada. And this was started by the initiative of 16 villages and the help of the hospital there. And because they don't have adequate resources, they decided that they'll pick lots, and some of the children will get to go to school. And years down the lane, around 25 years down the lane, the nursing students from that hospital actually did a retrospective analysis of those who went to school and those who did not go to school. And they found that the mortality was 2.5 times. So it was not just the fact that those who went to school did well in life in general, but it showed a stark difference in mortality also. So just one story.
Very true.
That, yeah.
Yeah, so in mathematics, we used to have in primary school or high school mathematics, QED, they would say, hence proven. Anyway, so the idea is that look at society, look at inequalities, then only you can look at health. Yeah, so now the question I had asked was, what do we do given this scenario? Anybody? As you are seeing, I'm not moving forward without getting responses. Any ideas?
Educate.
Okay. That
Yeah.
sounds like a more bullet point, but anyway, it's okay. It's not a magic bullet, quote unquote, but yes. One way to look at it is educate, fine.
If we are looking at improving health, then we need to address all the social determinants.
Yes, these are all anyway social determinants, where you are born, what you do, how skilled you are, what is your race. All these are anyway social determinants. Yeah, one easy way to say that is work on the social determinants. I'll just come back to this question again, and then we'll see what happens. Yeah, Sayantan, I am seeing your message. We'll come to that exactly. This is a classic cartoon, thanks to Sochara Community Health Cell. I became sick because of my poverty, and I became poor because of my sickness, even though the correlation is not homogeneous. It's actually the first one much more than the second one, but even that is largely true in this in our societies, that you become sick because of your poverty and you become poor because of your sickness. Let us take one quick example, and that's my favorite: tuberculosis. How is tuberculosis caused? Sorry, don't think that I'm patronizing. Generally, yeah, I'm preaching the choir, I know that. Yeah, how is tuberculosis caused?
Overcrowding, malnutrition.
No. What is the proximal cause?
You need to get infected with the TB bacilli, and
Correct.
once you
That's
have
the
a lower
bacteria.
immune
So
system,
correct.
yeah, it's a
When
bacteria.
does the bacteria become the disease?
Often when your immunity is lower, and then from infection
Yes.
it
So
progresses.
when does your immunity go low?
It depends on many conditions. Could be disease, could be lower nutrition status, lack of access to
Yes,
diverse
malnutrition.
nutrition.
Okay, when do we have malnutrition? Yeah, hunger, basically. Okay, so if I systematically undereat or don't take nutritious food, I will get tuberculosis. Or as Gayatri said, if you live in crowded conditions. So both of them lead to something, and that is poverty. So tuberculosis, of course, WHO long back classified it as a disease of poverty. Now the question is, what is the solution for tuberculosis? How do you tackle tuberculosis? What do you do to reduce tuberculosis in the society?
Improve the nutrition status of farm.
Yes, one is that nutrition status, but where is the malnutrition coming from?
Of access to food.
Access to food, access to income, basically, what Sayantan talked about, universal basic income. So you should work on alleviation of poverty. Now, what is the treatment given to this patient, tuberculosis patient? What is the treatment? I'm not talking about MDR, XDR and all, just plain tuberculosis. What is the treatment?
Food.
Is it?
Only
Is the medical
antibacterial.
community is
Dots.
dots
Antibiotics.
is sorry. One at a time. Yes. P Chan. Sorry, I don't know your first name. Yeah. Chan.
Antibiotics.
Antibiotics. Dots, as Anand put it. Direct, observed, therapy, short course. What is direct observation? When do you do direct observation? Of anybody, of a child, for example. When do you do direct observation of a child?
When they are in front of you.
Is it so? When do you directly observe a child? Or let me say I am doing a session. When do I directly keep observing a particular learner? I don't do teaching, I do learning facilitation.
When you think that they are not going to follow your instructions, so that it's kind of a surveillance.
What is it? when you
Kind
feel
of a
that they are
curve.
the deviant. Yes? Clear? So now who is considered the deviant here through direct observation?
The patient.
The patient. Okay, let us come to that. What is the treatment that P. Chan said? Antibiotics. Yes? Clear? So streptomycin, isoniazid, we all know that, right? Now, what is the advice you people give? I'm assuming all of you are medicos here largely. So what is the advice you give whenever you prescribe antibiotics? When should anybody take antibiotics?
When they have a bacterial infection.
No. Whenever you are writing the prescription, what do you advise the patient when he or she should take the medicine?
After
Sorry?
food.
Like at the right time and the complete course.
That is fine. But when? What times of the day? Yeah, sorry, I'm not seeing the chat. Yeah, some people have said after food. Correct. Why after food? Why should it be after food?
So that it doesn't cause gastritis.
Fantastic. So here is a person. Why did that person get the tuberculosis? Why did the person
Because
get
he is
tuberculosis?
poor.
Because of lack of food. And you are giving antibiotics. So naturally, what would happen to the person?
Gastritis. He'll get gastritis.
So what will the person come back to the doctor telling?
That his stomach is burning.
Stomach is burning, nausea, whatever. Correct? So what will the doctor advise, or as medicos, what will you advise?
Just a PPI in the morning. Nothing else.
You're still medicalizing it, huh? So what would you advise? Have milk, have egg, take proper food. If we were to be having proper food, would he have got the tuberculosis? And on top of it, you want to directly observe. Why? Who is the deviant? Sorry, am I making sense, all of you? Any question?
Yes.
Who is the deviant here? Who is the defaulter? Is it the patient? It's very easy, no? That's the tag everyone is giving, no? For the TB patients, defaulter. Yeah, I'm seeing some medical solutions here, but yeah, have high protein food, fantastic. If they were to be having high protein food, they would not have got tuberculosis in the first place. Am I right? So first thing is, public health has its blind spots. That is, it doesn't believe in the agency of the patient. The patient, the public health community thinks that the patient doesn't want to become healthy. And we all know how debilitating tuberculosis can be. But what we say is the patient is the defaulter. So you need to directly observe. So you're not believing in the agency of the patient. But his sickness came because of his poverty. And that's why there is a famous, I forgot to add that cartoon. I'll come. So if you want to tackle, yes, these days you have the nutrition supplements and all, and that is also outsourced to private sector. We'll come to that sometime later, not today. So the food and nutrition supply is also outsourced, and people are asked to adopt patients and those sorts of things. Anyway, we'll come to that. So we need to understand that there is a wash basin turned on with the tap on. If the wash basin's tap is turned on, what happens on the floor? What happens on the floor?
It's flooding.
It is flooded. So what would you want to do?
Shut the tap and not just mop the floor.
Oh, okay. Thank you. But what if I have a Katrina Kaif advertising the mop by this beautiful mop? So you will forget closing the tap. Anyway, so the idea is that we should all become tap turners off and not just mopping the floor is important. Even to reach the tap, sometimes maybe you'll have to mop the floor and reach the tap to turn it off. But turning the tap off is not visible. Mopping the floor is visible. Anand, closing tap means addressing the root causes, addressing poverty. And we are also talking about population level health and not necessarily individual patient, but individuals are also part of the population level health. Anyway, so, and that is why we have this great diagram. And the classic case is your predisposition of diabetes at the bottommost. No? I always give the example of the height of a Dutch woman. Anybody guesses what is the height of a Dutch woman? What is the average height of a Dutch woman? 5.5 one time. I'll run an auction. Another 2 chances. Quickly. Any numbers? 5, 10.
5'8".
Kevin says 6 plus. Actually, the average height of a Dutch woman is 6.2. Kevin is very near there. Can we imagine that as to why the average Dutch woman's height is 6.2? And what is the average height of an Indian woman? What is the average height?
5'4" or 5'2".
No, 4.8.
5.2, 5.3 actually. So what is happening? Systematic undereating, larger economic, social, and cultural conditions, living, working conditions, how much sanitation you have, how much hygiene you have, those ones. And then what is the sort of social support system that you have? Finally, it becomes your genetic predisposition. And this is the famous framework of social determinants of health, wherein what you see at the individual level is a product of larger socio-economic condition. Are we clear now? Sorry, you showed some study, you have shared some study. Yeah, fine, great, thanks. Yeah, people can refer to that study. Whatever, who shared that? Sorry, I didn't see the name.
Prasanna, Vasu here.
Sorry?
Vasu here.
Acha, Vasu, okay,
Hi.
okay. Yeah, it is put as VR, so I didn't relate it. Okay, so then I'll come to one more great cartoon. I'm just preparing the ground for you people. This is another famous cartoon from Sochara, Community Health Cell. Don't worry about the wordings, just look at the image. So I will read out if you cannot read. There is absolutely no partiality in this race. Whoever reaches first can take the cup. What is happening here? Is this race okay?
The participants are different in terms of the transport that they use. And
Ashok, you are not clear. Sorry.
Yes. The participants are different in terms of the mode of transport that they use as well as the personal health. And
Fine.
Race is
so what is the issue? I am the referee is being impartial. No, so what? He is being impartial.
all are not
Unfortunately, we can't hear you.
Same
Should I take off my
level.
video? Is it the problem?
No, I don't think so.
Yeah, sorry, Ashok, not
I
able to
think
hear.
he's saying not everybody is starting at the same position.
Yeah, we are still at the operational level. What is the trouble? What is it that is bugging all of you? I'll come to some of the words being talked
The
about here:
privilege
equality,
different
equity.
people have a different enough. Some
Sorry?
are more privileged, some are more privileged, and some are less privileged.
So
And
what?
even when you say that, yes, well, that actually determines how fast you can reach there.
Fair enough. So what?
Yes. Well, that is an injustice.
No, but
Okay.
what is the trouble? What is it that troubles all of you? What is it that is pinching all of you? Yeah, I'm getting the word from Sebin. What is it, Sebin? You might want to unmute and then talk about.
So the belief that this is actually fair, that the status quo is actually fair.
So what is the word?
The status quo that is
Nani,
currently,
what is the word that you're using?
the perception of the belief that
No, you are again going back. Fairness.
okay.
Fairness is the word. We are all troubled that this is an unfair race. So what? What is fairness associated with? Why do we look for fairness? Oh, justice. Very quickly we have come to that word. Very good. So we are seeing that this race is unjust. Point. Clear, all of you? This race is unjust. Now, what do you want to do to make it just?
Can we actually question that why that there shouldn't be a race in the
That
first?
is fine. Fine. That's a fantastic way to approach it. Why at all a race? Fair enough. No, but even given this scenario, how would you want to make it fair? Just tell me some methods in which.
Give everyone the tools they need to be like on equal ground.
Yeah, even then the elder person might not be able to drive the car, for example. Yeah, okay. Kevin says proportionately level playing field. How would you want it to do? Aarti, how would you want to do that? Unmute and then say.
Can make the person driving the car start at a father level.
So what are you doing ultimately?
Making this equitable and
Correct. But are you treating them all equally?
No.
Okay, so you will make the car fellow travel 50 kilometers, maybe the elderly person five steps, whatever. You will do something, no? So you are
But then
treating
the car
them
guy
unequally.
the car fellow might protest against this, right?
I'll come to that. Just hold on to that question. So you're treating unequally, isn't it? We are beyond equality now. We are not treating everyone equally. All of you clear?
Yes.
Now, the definition, that's what I wanted to come to. When we talk about equity, it is not just the sanitized definition, each one according to its need. It is about unequal treatments under unequal conditions to make the conditions fair for everyone. Are we understanding equity now in a better sense? Given inequalities, we are going to do unequal treatments to move towards fairness. Am I clear? Yes. So equity, of course, everyone according to one's need is a very, is a valid statement, but it divides it of something else, which I'll come to shortly. And that is why you need to look at this as an unequal treatment. Given inequalities, you have to treat unequally to move towards the path of fairness and justice. Am I clear? All of you?
Yes.
Anybody else? Eliminate the race. Yes, we all talked about eliminating the race. So I wanted to come to the definition of equity in a much more convoluted way, and that is why all this circus. So, and then this one is all of you know this, no? This famous one, equality, equity. We are beyond all this now. We say liberate. Why have the barricade at all? Remove all the barricades, and then now we are into liberation. Okay, so that is the idea. Anyway, so justice, somebody asked, no? The powerful majority might not want to, that car fellow might not want to go 50 kilometers. You might want to be ahead in the race. And that is where you have the definitions of justice. Justice as fairness and reasonableness. Justice means all of you talked about universal income, healthcare, everything. Justice means also each person receives her share of her dues. Burdens and benefits are equally shared. Most importantly, and that is the principle of solidarity also, the powerful minority, in this case, the person sitting in the car, accepts their fair share of burden and feels the need to protect the powerless majority. That is the principle of solidarity, justice, and fairness. Am I making sense? All of you?
Yes,
Any
but
questions?
can I ask it out?
Yeah, go ahead, go
I
ahead.
don't know if this question is right.
No,
But
no, don't worry.
when you say
There are stupid
protect the
questions.
powerless majority,
Mm-hmm.
I I find something wrong with the word protect. I don't know what it is.
Okay, we
So
can use
shouldn't
other
there be a
formulations.
redistribution of power?
Yeah.
Shouldn't that
Okay. Or we can say the
and
powerful minority is in solidarity with the powerless majority. Is that okay?
yeah, it is okay. But even then, shouldn't when you come to justice, shouldn't there be a redistribution of power?
That's what it is. So the powerful minority, for example, gives more taxes for you to run a universal health system. Are you understanding? So I always compare two people, Mukesh Ambani and Ram Prasad. I mean Ram Prasad as in the marginalized person and Mukesh Ambani. So Mukesh Ambani or whosoever pays or Prasanna pays his fair share of taxes or more than his share of taxes, and in such a way that the powerless or the what you call the majority are also benefited from that. And I'm seeing some chat window. Okay, so we are not talking about Samaritans here, Tishtar. We are talking also about solidarity. We are also talking about justice. So it is not about the goodness of somebody or volunteerism of somebody or a charitable work of somebody. We are talking about justice as in society moving towards justice and lesser inequalities. Yeah. Okay, we'll come back to this. Now, I need an honest raise of hands. How many of you like politics?
Can you repeat the question? Sorry.
How many are in this room? How many are we? 40 people. How many are we liking politics? Two? Only two? Three? Okay. Four? Or am I missing the count? Six. Oh, how do I get an overview? Sorry, I'm not getting the overview. Okay, about 7 to 8 people have said they like politics. And Mike is vigorously shaking his head. He's not liking politics. Okay, just hold on, Mike. I think you're also muted anyway. Huh. So let us get to the definition of politics. What is politics? Anybody? Okay, so 7 out of 40 said they are liking politics. So which means majority are still disliking politics. Let us say, so what is the definition of politics? Anybody wants to unmute and then say whatever definition you understood about politics? It's okay. Please unmute.
Shantan says power.
Okay, politics as
Negotiation,
power.
negotiation of power.
Politics as power, fine.
I understand it as something about the polity, that is the people, like which also includes
People conflates
hierarchy
with something
and,
called democracy.
yeah. No, not just
Practicing and
democracy,
theory.
but
Sorry.
Go ahead,
no,
one by
okay,
one.
continue.
Influencing people in governing institute, making decision for community.
So you're talking about government actions as politics. Okay. So somebody is telling politics is power. Somebody is telling process of making the decision. Akshay says, somebody is telling me that the stand we take on a particular issue. So somebody is talking about government actions, that is governance, all those policies, those ones, governance and power. Anybody else? Anything else? Okay, so I'll give you 3 words. I'll give you 3 words. Sorry, Sayantan, 2 minutes, 2 seconds. I'll give you 3 words. One is electoral politics, politicking, and politics. Now tell me where you are. Sayantan, go ahead. I hope I'm spelling your name correct.
Yeah, it works. No, I was just saying, I said negotiation of power, not just power.
Okay, fair enough. So we all understand politicking. Yes or no? Okay, so people seem to not understand politicking. Politicking is about backbiting, about doing background maneuvers, influencing, those sorts of things. So that we are not talking about. Then there is electoral politics, the politics of labor, to make Mike understand, the politics of labor or the politics of conservatives, politics of BJP, politics of Congress. So these are electoral politics, or the voting and the franchising and those sorts of things. And then there is the last one, the politics. And I'm asking for a definition of politics. So we rule out those two. Now tell me what the actual definition of politics is. Okay, let me run one by one. So politics as acts of government, a very narrow definition. That is more about what we call governmentality and all, but yeah, I'll not go into that. But yeah, so just the governments doing some things, governments of the day acting on something. Politics as power, definitely. Politics as power as in who gets what, how is it distributed. So it is about production, distribution, and use of scarce resources. So politics as power is a very commonly understood definition. Yes, all of you with me? This comes from feminists. Politics also means autonomy over one's own health and one's own body. So feminists gave the famous statement, personal is political. So I have to have autonomy over my own body. Nobody needs to tell me you cannot get abortion. For example, the debate that's going on, the presidential debate in the US is around abortion and reproductive rights and all. So the feminists brought in this concept that personal is political. That is, I have an autonomy, I have a right over my body. And nobody needs to tell me what I should be doing about my body. All these are fine. All of you comfortable? Sorry, I'm not able to see the rest. And now comes the actual definition of politics. And this was given by a famous philosopher, Dan Beauchamp. Politics as a search for common good and a just society. Just as in justice, and fairness. Are we understanding now? This is the actual meaning of politics. What is it? Search for the common good and just society. What were you people trying to do here? Can somebody answer me? What were you searching here?
Justice.
So what were you doing?
We're trying to make it as fair as possible.
Correct. What were you doing effectively?
Politics.
You were being political. All of you understood this now? None of you told me that this race is fair. Yes or no? Sorry, I can't see anybody. Yes or no? None of you said this race is fair. Yes or no?
Yes.
So if you did not see that this is fair, how could you not like politics? So all the 40 in the room did not like this race. Means you liked politics. None of you liked this inequalities. Clear, all of you? None of you appreciated this inequity. And that is why you are all political. Am I making sense? Yes or no?
I
Yes.
think Vidya has her hand raised. Do you have
Sorry?
a question, Vidya? No, Vidya
Sorry, I
has her
can't
hand
see.
raised for a while. Do you have a question? In case you do, please unmute and go ahead.
I could be the hand
No,
for.
no, I raised it for an earlier question. Sorry.
Sure, no issues. Do you want to still go ahead with that
No,
question?
no,
Go
no.
ahead.
We can go ahead. We can go ahead.
Yes, Sabine, what would you want as clarification? Sorry, I'm seeing the chat now.
No, that was about politicking that you already.
Okay, great. So I'll give you an example. Is there a pulmonologist in the room? Is there a pulmonologist in the room? Okay. The medical community understands who a pulmonologist is. Yes? I'll target Gayatri today. Gayatri, sorry, since I know you are a medico, I'll take your name. So Gayatri is trained as a pulmonologist. She also went through equity and other things. So she's decided that she is going to treat patients in a slum free. Clear, Gayatri? All of you all clear? Gayatri says, I have understood equity concept. I am trained as a pulmonologist. I am going to treat in a particular slum. I don't know where Gayatri is placed these days. Anyway, in a particular slum, I am going to treat everyone free for tuberculosis. And she puts up a board telling that free tuberculosis clinic. And the timings are 10 a.m. to 5 p.m. All of you are visualizing this? Gayatri wants to serve the people. She puts up a board, free tuberculosis clinic, and then says the timings are 10 a.m. to 5 p.m. What happens? Will everyone rush to Gayatri's clinic?
No.
Who comes? Daily wage workers can't come. Fantastic. Shay. Who else cannot come?
Women can't come.
Sorry, you're not
Women,
clear.
assuming women are taking care of household.
Okay, women cannot come because of household chores, or even if they are going as daily laborers. That's fine. Why else can women not come?
Stigma.
Maybe they
As
don't
in?
have like the money or the transport to come.
No, she is telling yeah, that is one more, point. The transportation cost could be high. What stigma, Gayatri? or Shay. Sorry, I don't know how to spell Shay, whatever. Huh? I'm going by Sheikh Bevara. Huh?
That is what it is. That's his name.
Oh, sorry. Huh?
The stigma of TB still carries a lot of stigma, especially
so what?
marriage. So they don't get married if I mean they are not able to get married if people know that they have contracted TB or had TB.
Yes. So women get divorced once they are abandoned by husbands or partners, whichever way you want to look at it. The moment, in India particularly, the moment somebody comes to know that the women carry tuberculosis. There's a famous book by Uplekar and Rangan, in which it details out a case story of what happened to Shanti when she was detected with tuberculosis. Anyway, Uplekar and Rangan have for years, decades worked in Pune on tuberculosis. Anyway, so what would Gayatri want to do then? She said, okay, I'm wanting to serve people. As a medico, I want to give free services. What happened? What would she want to do?
Go to their homes.
Go to their homes, clandestinely, secretly, and also change the timings, for example, of the clinic. Remove the board, for example. Simple thing like free tuberculosis clinic, you remove it. You go house to house. So what are you doing, Gayatri? Or anybody else can answer. What is Gayatri doing by that?
Giving equitable care.
So what? What are you doing? Removing barriers is she is being political because she is recognizing the inequalities. And so she is trying to be political. So she is moving from being a medico to being a health professional. Do we understand this? A medico, for example, a Gayatri, being a medico would be very happy treating patients and then getting the kick out of it. But Gayatri wanted to be a health professional, and that is why she abandons the idea of quote unquote clinic and then goes house to house, recognizing the inequalities in the society. The moment you are recognizing equity, the moment you're recognizing stigma, the moment you see some of these things, you're already being political. It's a Tina factor. Tina? How many of you know Tina? Our friend? Anybody knows Tina? There is no alternative. Sorry, there was a comment, I think. Yes, if doctor thinks her personal life is getting affected, she's still being a doctor. Of course, personal life is important. But if you are moving on the path of health, you would work around. You will find a way out of, for example, instead of doing 10 to 5, she might do 9 to 3, for example, or go house to house in the evening, whatever. She will sleep during the day. So you find ways of overcoming the barriers. Somebody said overcoming barriers, breaking the chain, whatever. Am I clear now? All of you are with me? I'll give you. So that is why Virchow, am I still sharing? Yes. Virchow, called the father of public health, made a great statement. Medicine is a social science and politics is nothing but medicine on a grand scale. It is translated from German, so it becomes medicine, but it is health in effect. Health is a social science and politics is nothing but health on a grand scale. So whatever inequalities you see in the larger society is what you will see as health inequalities. So whatever politics of your nation, that determines how healthy your nation is. Politics as in looking for social justice. Politics as looking for fairness. Politics as in looking for equity. Am I clear? I'll give one more example. Anybody from the mining areas here? Bokaro, Bellary, whatever. Hello? Nobody from any mine? Chhattisgarh?
Near
I'm here in Bokaro.
Sorry? Sorry?
Near Tamil Nadu.
Neyveli. Fantastic. Neyveli. Okay. Again, a pulmonologist. What's your name? I didn't see your name. Sorry.
Porcelain.
Siddha physician. Siddha.
Porcelain. Okay.
Ah.
Porcelain again is a pulmonologist. Okay. And he opens a clinic in Neyveli. What clinic? Lung clinic. Right? Because he is pulmonologist, he would open a lung clinic in Neyveli. Yes? What happens to his clinic? Let us assume he is also a private clinician. He has a private clinic in Neyveli. What happens? Hello, medicos? Anybody else?
The
What
chances
happens?
the chances that he will get patients with pulmonary disorders are very high.
So he will thrive. If he is a private clinician, he will have roaring business and he will be rich in months. Yes. So as a medico, he will become rich. But if Porcelain wants to work on health or become a health professional, what would you do? I'm asking.
He'll try to minimize the incidence of all the pulmonary diseases.
How? How would he minimize? Yeah, Anand is telling work with the unions. Fine. As what? How?
Probably against the mining, illegal mining.
Sorry, Aparna. There was disturbance. Repeat again.
He'll have to then go against the mining industry as such, and then probably.
Correct. How will he do? Basic action. What could it be? So Anand is telling work with unions. Kevin says communicate with National Pollution Control Board. Yes, but as what? As how? A simple act. Okay. Aarti is telling organize people. Sorry?
By simply providing masks for the mining workers, so prevent like dust coming there, silicosis.
Will that help? It will help to some extent, but will it remove the root cause? What is the basic act he would do? He or she. I mean, here it is Porcelain. Fundamental act. Somebody said educate is fine. Somebody said working with the unions is fine. But with unions, what would be done?
Organize the community.
Fine. How? Great. What is the first act? Simple act that could be done. He could petition. All of you are understanding petitioning?
Yes.
He embraced Marxism, Akshay. Yes, in a way, yes. So he would petition, Porcelain would petition the Pollution Control Board, petition the authorities, telling them that the emissions should be restricted or the silicosis is happening or whatever. Clear? So what is this act of petitioning or educating or organizing? What is this act? Kevin is telling politics, and that's correct. So if you have to move from being a medico to a health, the TINA factor is that you should be political. Am I making it clear? Is the message driven home? That if you are a health professional, you cannot but think about politics. Okay, now the last concept I'll try and see if I can introduce today. Markets. How many of you understand the logic of market? Which was the season now that went by? Yeah, we can say mangoes. All of you understand mangoes, no? Yes? Mangoes? Everyone? Give me some response. People are happy chatting. I want vocal answers. Anyway, that's okay. So, what happened during mango season? How much would you get for a kilo of mangoes? Sorry, Mike, this might be a little out of this thing for you, but yeah, you appreciate mangoes, no? So a kilo of mangoes would have costed us 100. What is the kilo? So what, now that the season is over, what would be the price of mangoes if at all you get? Only
500.
500 is more like it. 200 is too charitable, Kevin. 200 is too charitable. Okay, so what is happening? What happened 2 months back and why is it higher now? And I'll have to get hold of 2-3 pens now. Yes, please. Demand and supply. Kevin, you might want to unmute and then explain what is demand and supply. If you can unmute. No, not arbitrage, Saintan. Arbitrage has a different connotation. Okay, so
basically, production is higher, and that creates a supply. Production being higher is the supply, and demand is when people are willing to buy it. In summer season, usually people will prefer something cold or some juice to drink and stuff like that. So all those factors are there, and being it's seasonal, people are conduced into that. Like they're more open to buying mangoes only during the season and not during other seasons. So there will be more demand.
Yeah, as a more fancy, people might still buy or who can afford it, but generally people buy mangoes during the summer season, largely. So it is a play of demand and supply. Clear? And that is what is market logic, in the sense that at a very basic level, you have demand and you have supply. More the demand, and if the supply remains the same, the price goes up. And if the supply is more and the demand remains same, then you have the price coming down. Let me see if I can use whiteboard. Is it there? Yes. Yeah, this PowerPoint will stop sharing. It will go to whiteboard. I hope it's okay. Okay, so now let us draw some things. Quickly, let me try and draw. Don't look for aesthetics, please. Okay, so this is the demand curve. This is the supply curve, the one going from left to right, or southwest to northeast. But don't worry. So that is the supply curve and demand. So, and this is the price. The y-axis is the price and Q is the quantity. Now, supposing I shift the demand curve. Can I change the color? So I will shift the demand curve up. That is greater demand. What happens to the price? Price was here. The price was here, okay, at P0 assumed. Now the demand has shifted. So what has happened to the price? What has happened to the price?
Price has increased.
It has moved higher. All of you are clear? Yes? And now, supposing I change the color, let us say I'll make it whatever color. Now the supply, there is an increase in supply. So the original lines are black lines. Just have that in mind. So the supply curve shifts. What happens to the price? What is happening to the price? So with more quantities there and the demand remaining the same, what happened to the price? Hello? Is somebody texting? I can't see the chat.
Price decreases.
Price decreases. Okay. So this is the fundamental market logic. I need to get hold of. Sorry, I forgot.
Give me just a second. Give me just a second.
Sorry. All of you are understanding this concept now? So this is the fundamental market logic. Clear, all of you? Shall I rub this off? I need to move towards something else. I forgot to pick up my pens. 2 minutes, give me. Sorry. Okay, what are you seeing here? Are you able to see?
Yes.
Yeah, what happens? Yeah, Anand, I'll just answer your question. I just saw your chat thing. Huh? What happens here? What is happening here?
Choice.
What is, sorry? What is happening between
There
all
is
the
a
four?
choice.
No, but what is happening between the four? So one is by somebody Pentonic, the other is by whatever. Yeah, there are 3-4 pens. One is Rorito. Yeah. So what is happening between these people?
Competition.
Competition, right? So markets bring quickly. Markets bring competition. So what happens to, what is the next corollary?
Price comes down.
What
Price
happens?
comes down. Variety is there.
Yeah, 1 second. Lower prices and choices. Correct? Are we clear? Yes? Now, and then we say customer is queen, king, whatever. Hey. All of you with me? Right? So if I have to compete in the market, the price is decided by the market. There is an equilibrium here, right? When the demand shifts, sorry, Anand, you had asked the question, how does the demand shift? So the demand curve is, if you see the supply curve, when the supply increases, it comes down. And when the demand increases, it goes up. So that's how the movement of the demand and the supply curve is. Yeah, okay. So now, given a particular product and a particular position in the market, the price is decided by the market. There is an equilibrium. Kevin, just hold on. Let us understand economics and then we'll come to. Okay, all of you with me? The price is decided by the market. I cannot change it. Given a choice, nobody will be ready to pay 200 rupees for this pen. Yes or no? How many of you are ready to pay 200 rupees to any of these pens? Hello?
No.
Nobody is
want to.
ready. You don't want to pay. So the price is decided by the market already for me. Okay. What is the mantra of my of any business? What is the basic mantra of any business?
Make profit.
Make profit. How will I make profit if the price is already decided by the market? Yeah, the brands are Pentonic, Reynolds, whatever.
Quality.
Sorry?
Quality.
Quality.
Efficiency.
No. The price is already decided by the market. Okay, whether you want it or not, nobody is ready to pay me 10 rupees. I mean, more than 10 rupees for this fund.
Sell
Sorry?
for more people. Sell for more people. Increasing
Selling
market
more,
share.
marketing also costs you more, no? So your
Market
profit
share,
margins
market
come.
share.
Correct. How will you increase it?
Increase
By
the market
marketing,
share.
na? Through marketing.
Yeah.
So if you market more, then your cost will become more. So your price
Reduce
margins
the
will come down.
production cost.
How do you reduce the production cost? No, eliminating competition. All wild ideas. Anyway, how do you reduce production cost?
Lower the wages.
Sorry?
Lower the wages.
Lower the wages.
You people are all too radical. Okay. So economies of scale is a good word, Sayantan. So what you do is you reduce per unit cost. That is, supposing you have a machine which manufactures 200 pens per day, you will try and manufacture 250 pens per day. Am I clear? So that your per unit cost reduces. All of you with me? Hello?
Yes.
Yes.
Sorry, I can't see anything other than my screen now. So you people have to respond. So my per unit cost reduces. What is the word we use when you say you get more from less?
Productivity, efficiency.
Not productivity, efficiency is the word. When you do more from less, you're doing what is called as value for money, also called as efficiency. Am I clear, all of you? Yes?
Yes.
So I don't know whether this allows me to do that. Yeah, so you will have higher. Correct? Everyone. Yeah, return of investment is profit, and profits increase, Vasu. Profit increases when you have better efficiency. What are the ways in which we can do efficiency? We'll do that in the next session. So one way, a simple way I told you is make the machines produce more pens. Clear? So 200 pens you are manufacturing per day, but for the same machine and same electricity, if you manufacture 250 pens, your unit cost comes down and you are being efficient. So Adam Smith, and I'll have to stop this share. Adam Smith, that is why called market logic as the invisible hand. How do I share this? So he said, put everything to market and the invisible hand will take care and everyone will be efficient. Am I clear? This is the fundamental market logic. Okay, now I do the counterfactual. I remove these three pens. All of you are seeing me? Am I visible? What is being seen now?
Single pen, no
What is this
competitor.
called? What is this called?
Monopoly.
Monopoly. So monopoly is the counterfactual to the competition. So in monopoly, what happens? No choice. Yes. Because I am monopoly, I am not bound by competition. I can put any price that I want. Yes or no? And because there is no pressure of competition, I don't need to be efficient. Am I clear? So the counterfactual you're all understanding, no? That competition brings in lower prices, choices, and efficiency. That is, you can do more from less. That is, if you're given only 10 crores to run your healthcare industry or healthcare sector, if you're more efficient, you can give more services to people. That is efficiency. Yes? And if I'm a monopoly, I am inefficient. Is this logic? All of you, all of you getting this logic?
Yes.
So when you say inefficient, you mean from the perspective of the entire economy, right? Buyer plus seller.
Yes, yes. No, no. Seller is
profitable.
Seller is sitting pretty, no? He need not have to become efficient. He need not have to perform well. He or she, I mean, it's not he or she or it, whatever. So the manufacturer is sitting pretty. The manufacturer need not worry about the customer or going bankrupt or whatever. Yes, because there's no competition. So the behavior is called monopolistic behavior, and it's an inefficient behavior. Right? All of you understood this? So let us apply this logic for healthcare. Public hospital, Apollo, Fortis, anyone else? Any other name?
MGM.
Sorry?
MGM Healthcare.
MGM Healthcare. All of them competing with each other? Prices are lower? Hello? I'm
Yes.
asking, are prices lower?
No, no, no. Prices are not low.
Why?
No.
Simple
It's a
market.
positive feedback loop. Positive feedback loop.
Sorry?
The prices
What do you
are
mean by that?
determined with, insurance and policies.
No. There is
Demand
something
is
else.
They have decided amongst themselves and set a price.
No, no. It need not be cartelization. Even otherwise also.
Distribution is not uniform throughout. Like not every region has the same kind of competitions there. Though there are multiple corporates, there is not the distribution is not uniform throughout, sir.
How many of you seen Bangalore? Bangalore,
Yes.
there's a particular road called Bannerghatta Road where Apollo and Fortis are next to each other, by the way. Have you seen any other business having the same business next to each other and profiting? Okay, so what is happening?
Yeah,
The same
jewelry shop.
market lot.
There is still demand for more competition. Like there is still more space for competition.
Why? We are
The
talking
same
about
market.
4 different players, markets. We are talking about competition between them. Fortis will, supposing there's a public hospital, Fortis will start giving bypass surgeries at 1 lakh, for example, or Apollo will start giving it at 80,000 because they are competing with each other. Why is it not happening?
The government setup is inefficient enough that so that the competition is among the elites is very
Even
much
then,
concentrated
let
on
us
them.
say, okay, let us say I did this. Manipal Hospital, once I did it for some friend. Manipal Hospital does the CABG, the bypass one, for 4.5 lakhs. Okay. Fortis does it at 4.7. Apollo does it at 4.8. Jayadeva is a public, I mean, it's an autonomous institution. It does it at 1.5. Why are Fortis, Apollo, and Manipal not reducing it to 1.5 to be in the competition? Is my question.
Sometimes people believe that higher the price, the quality of care is better.
No.
Also, like patients don't have access to all this information always. Like you might just go by the brand name and the doctor's name, not like no hospital is putting out any stats related to cost or patient outcomes.
The
Okay, good.
customer base is different.
So supposing who responded? Aarti? Was it Aarti who responded this?
No, it's Tishta.
Sorry?
Tishta.
Okay, Tishtar. Tishtar wants to buy a mobile. Okay. What does Tishtar do? What do you do, Tishtar, when you want to buy a mobile?
Like you look up the different models, the prices, compare it. You know
And
what's on the market.
correct. So you will look for all the operating system, the camera, everything, and you are more or less decided on taking, for example, Samsung phone. Right? You are more or less decided that you would want to go for Samsung phone. Assume, visualize. You go to the shop. The shop fellow tries to sell you LG phone. What happens? What will you say that tell the shopkeeper?
In that position, like I'm not desperate for the phone in the moment, so I can just walk away from the situation.
Or you will say, don't fool me. I know
Yeah.
all the factors. Yes or no?
Yeah. Yes.
Okay. Tishtar, are you medical? Are you a medical
Yeah.
professional?
Yes. I am an MBBS doctor.
Okay, fine. I am not a medical.
Okay.
But I'm a health professional. Anyway, okay. So I have a friend who gets fever. Let us say. Okay. I bring that friend to you for treatment. Okay. And you write Calpol as a medicine. Right?
Okay.
You understand Calpol. What it stands for, I will tell you. Anyway. But does Prasanna, also knowing, also in the health field, fight with you like you fought with the medical fellow, mobile fellow, telling that why are you writing Calpol? Why not Dolo, the chocolate of India now, the new chocolate? Anyway, why not Crocin?
No, they just accept whatever I give them, thinking that I know more
Sorry?
than them.
Yeah.
Like the patient usually accepts whatever the doctor gives, thinking that the doctor might
Exactly.
have
It
their own
is
reasoning. Yeah.
patient is not the direct consumer. What the doctor knows, the patient doesn't know. While in the case of mobile, both of them knew the same information. It's called information asymmetry. Somebody mentioned in the chat something similar to that. So there is always an intermediary who takes the decision. And that person could be influenced by a 5-star conference or a pen or a trip to Singapore. We all know these stories. Anyway, clear all of you? And now I will give you an example of Oviran. How many of you prescribe Oviran? Anybody knows the story of Oviran? What is Oviran? Hello, medicos. And we are losing time.
Diclofenac.
Diclofenac. By whom? By Novartis. By the way, how many of you know Oviran is the costliest diclofenac? Do we know this? Do we also know that Oviran is the most sold diclofenac? Why? Any other product, for example, Mercedes-Benz, is it very costly? Yes or no?
Yes.
Does it sell the most?
No.
So why does Oviron sell the most despite being the costliest diclofenac?
Because the population buying it doesn't know better.
Information asymmetry. Then there are two more conditions that happen. For example, Gayatri goes to a cinema theater, buys a cinema ticket. Gayatri uses the cinema ticket, enters the hall. Can anybody else use it?
No.
But what happens in the case of, for example, a TB treatment? Let us say tuberculosis treatment. What happens? If I give tuberculosis medicine to one person, what happens? Or a vaccine. Vaccine is easier to understand. If I give vaccine, what happens in the community?
Herd immunity. Yeah.
Herd immunity happens. So you give to one person and 10 people benefit from it. So this non-exclusivity is not valid for health. All of us understand this? If you buy a ticket or cinema ticket, or if you buy an apple or whatever, you are consuming it and finishing it off. It cannot be used by anyone else. While in the case of vaccine, for example, you have herd immunity. So if I'm a manufacturer of vaccine, what would I want to do? Would I want to manufacture the vaccine? If I sell one and then 10 people are benefiting from it, what will happen? What happens?
More people will not buy it.
So what will happen to me as a manufacturer?
I will not create profit.
I will stop manufacturing. Again, it's not following the market principles. All of you clear now? Third point. Supposing I build a park. All of you understand a park? Okay. I put an entry fee also. I'll say 10 rupees you should give to enter the park or the garden. All of you with me? So the one who enters the park will get fantastic fresh air and all those things. Health again. All of you with me? Then what happens? But the park has, supposing 4 roads. Imagine a park which is in a quadrangle. And then there are buildings across the park. Are you with me? So will they also get fresh air? Yes or no?
No.
Why should they not get fresh air? If the park, they will get. But who is paying the 10 rupees to enter?
The people who are entering.
So if I am a manufacturer of park or a constructor of park, will I be interested in doing it? If there are what are called as free riders? Are you getting what I'm telling? So these are all called as market failures. So economists don't say markets fail health. Economists say health fails market logic. All of you are getting the understanding now? All of you clear? How many are left? What are we time? What time are we at?
We are at 8:24.
Okay.
36 participants.
Fine. That's okay.
Could you please explain that once more briefly? The last point.
Yeah, we are doing. I'll try and wrap this up. So we need to understand market logic and why health doesn't follow market logic. Health fails markets. And for these reasons, I'll skip this. I'll just come back to it. For these reasons, health is a market failure. One is information asymmetry. You have externalities and you have what is called as public goods. Okay. So because of this, health cannot function. Economists have a problem. Economists always believe in one factor. Anybody knows what economists are always concerned about? Quickly.
Utility.
Sorry?
Utility.
Sorry, you're breaking.
Utility.
Utility, yeah, stems from where? Where is that utility stemming from? Which word?
Gavin has said value.
No. No. I'm seeing the chat. Yeah.
Efficiency.
Efficiency for what? Why? Why do you need efficiency? Because of the word called scarcity. Yes, resource scarcity. So economists are always worried about scarcity. They say resources are scarce. That is why you need to make decisions. And yeah, Akshay, depends on which school of economics, it's all fine. Yeah, that's fine. Development economists like Jean Drèze and all have a different take, but I'm talking about overall regular economics. So economists are always worried about scarcity, and in health particularly, scarcity is defined by 3 factors: the desire to remain healthy, And one is because aging population are more sicker. Elderly people are more sicker than younger ones. With the real increase in real income, the desire to get more healthcare is there. Real income, not real incomes as in adjusted to inflation. And third is new technologies that come in. So you have the latest new MRI, latest robotic surgery, all this, which creates what is called as scarcity. On the other hand, you have also the regular scarcity of resources, land, labor, capital, all of this. So what economists say is, given this scarcity, you need to have decision-making capability. And economics gives you the tools for making the decision. And what is the decision based on? Based on two principles. One is called efficiency. The other is equity. They are not so worried about equity as much as they are worried about efficiency. And efficiency because they need to do more from less, because the resources are scarce. All of you are understanding? Because the resources are scarce, you need to do more from less, and that is why you need to become efficient. And that efficiency is a decision-making tool. All of you with me? I could complete politics and economics. I like to do the next round much more on combining politics and economics. So economics give you tools for distribution. Economics give you tools for decision making. So in a scarce scenario, how do you divide? How do you decide who gets what? How do you get more value for money? How do you do more from less? Am I clear? So in politics, you have decision making through power to distribute resources. In economics, you're given the tools for decision making. All of you are understanding? Politics is about decisions around distribution, and economics is around helping with tools for decision making. And we'll complete the political economy next round. And two small things. Sorry, is there a chat message?
Sayantan has asked, what about politics behind scarcity? Isn't it manufactured more times than often?
Yes, we will talk about the political economy when we combine politics and economics next time, as to what is happening exactly. Sorry, because there was some time needed to warm up. I hope next time we will be faster and we should be doing better in terms of our efficiency. Anyway, even though I don't so much give into efficiency as much as getting the messages across. Any questions? Last 2 minutes, and then we can.
Prasanna, I have one question.
Yes.
There's one recent news where they have said that they have increased the ceiling price of certain medications. So there is some market logic behind that also. So can you clarify what is the argument for them to increase the ceiling price of certain essential medications?
Okay, again, it's a principle of supposing you are you are manufacturer of tuberculosis drug. Let us assume. Okay, what is your mantra as a manufacturer?
I want to generate profit.
Okay, but who gets tuberculosis?
Poor people.
So if you want to generate profit, what should happen on the other side? I'm really doing it fast, huh? What should happen on the other side?
There should be demand.
There should be buyers. What happens to tuberculosis? Who is the tuberculosis patient? Who is a typical tuberculosis patient? The poor.
Poor.
Can they buy?
No, purchasing power is not there.
So what would happen if I'm a manufacturer of a TB drug?
I will go out of business.
Would I be having the incentive to do it?
No.
And that is the failure of market. And that is why the invisible hand doesn't work, and the government has to step in as a visible hand. Do you understand? And now, typical scenario happened. Some of the costs of the drugs or the what we call active pharmaceutical ingredient API, the cost had increased, but the concomitant increase had not happened of the medicines. One manufacturer was telling me about albendazole, which has got the price increased, So they were not even recovering their costs of manufacturing. And so they petitioned the government that they are not able to recover the cost. The government has the leverage under Article 19 of Drug Price Control Act. And so they could, under Section 19, they could increase the prices of those drugs arbitrarily, looking at what are the costs, what is the market scenario and all. The government makes a decision, and National Pharmaceutical Pricing Authority has taken a decision. Tricky to analyze, but I know for sure 2-3 drugs where Chinu, our low cost manufacturer, who is a rational manufacturer, he was talking about how 2-3 medicines were really costlier than the market price, and then there is a genuine reason for 2-3 at least of the 8 drugs. Okay, so it's a larger discussion which we have to have on drug price control order and all. Yeah, so 2-3 announcements. One is you can access all the material, including this recording, on the LMS. So you whole intent behind doing this online and also having it as a repository. Any other questions? Was it all so crystal clear, or was
There was one
answer your
question.
RSS and politics? It's a tricky thing to answer. I didn't get into it anyway.
Kevin has asked, can you give an example of a free rider in healthcare?
Everyone is a free rider in healthcare. Vaccine is a typical free rider. No? You give a vaccine to one person and then it creates herd immunity, no? So the rest of them are all free riders. Even the park, if you consider park fresh air as health, forget the healthcare part of it. That's a free rider, right? In the sense that the park is made, you put an entry fee into the park, but the surrounding nonsense. Any other questions?
No, but that would be public commons, right? The park example.
Yes, precisely the issue.
Not usually free rider.
That is why it is called public goods. Public goods are all sort of free riders. Public goods generally, that is why fail markets. So given a choice, if I'm a manufacturer of a public good, I would not want to, because one person uses it and 10 people benefit from it. So I'm always under supplying it. Or I won't want to get into the market itself. Sorry, am I clear?
Yeah. Makes sense, but from a purely economic point of view. That's why you need the state to step in and support this with subsidies.
Precisely why the invisible hand doesn't work in market, and market failure is what it is talked. And you need an active hand in the between. You cannot have it what is called as laissez-faire. That is, leave it to the market, leave it to the people. I'll deal it with a little bit more detail in the next session. What happens when we do markets and what happens when we talk about justice in markets. Yeah. Yes. All good? All happy or not happy, whatever. Fine. We can end the session. Yeah, please access the LMS. Whoever wants to read through, they can do that. Who is sir? Sorry, Kevin. I am Prasanna. No sir business.
Before we end, thanks Prasanna for taking this session, and hopefully we will continue to join in the next few sessions and continue this dialogue. I just want to say that there are some additional learning materials that have been suggested that are present in the learning management system. The link of the LMS has been put in the chat by both Akshay and I, and please reach out to us at any time. I'll just share my email ID, and we can share. If you have any issues with accessing anything, please let us know.
And also the discussion board. There is a discussion board. People can start asking.
There is a discussion board on the learning management system. You can ask your questions in case you have any questions later, and those questions will be visible to everybody. So everybody can be part of the discussion.
All of us learn together. Thanks.
Thank you so much.
Yes.
I'm just adding the email ID in the chat, and we can end the
Yeah, you might
session.
want to circulate it
Thank
even in
you.
your groups. Yeah. Great. Thanks. Bye.
Thank you. Good night.